And as you can see, we tried to get make sure that there was diversity in terms of issue area that folks are working with, and you'll learn that more when you hear what they discuss and what they do, but also whether they are working in an academic setting or a community setting. As we know, we're all community folks, right? We're all community members of a community. However, that is the role that they, put on when they walk into their day jobs and all around the clock jobs as we know. So I'll get started. I'll just get started with the question, but I won't get started with the question. I want them to introduce themselves, sorry. And maybe 2 or 3 minutes of just a little bit more about who you are and what you do currently, but also briefly a research project that you think you'll discuss a bit more in depth throughout the discussion. I'll start here. We can popcorn it, but I'll start with you.
Good afternoon, and I'm excited to be here today to share with you the work we do at Sankofa. Sankofa CDC started in 2008 as a health-centered community development organization. We invest in capital projects as well as empower citizens of the neighborhood to take leadership of their health and advocate for what they want to see happen in their community. And through our tenure of work, we have partnered with a lot of universities and been a leader in identifying what's needed for our community in areas of food access and healthy nutrition education and cardiovascular health, addressing health disparities, and also building projects in the community that deal with just those things we know of as those social determinants, which impact people's quality of life, and those barriers that impact how they are able to live, their longevity as well. So one of our projects that we are working on with academic partners, and some of them are actually listed here. A couple of partners who we work with who aren't listed here, one of them is in a room, Dr. Fatima from Southern University Ag Center. We worked integrally with Southern on a lot of our food garden-based projects and training with farmers and urban growers. Also, Dillon University we work with and explore partnerships. But we're working with LSU Medical Center. We're talking with Xavier University. We partner with Xavier for presentations and research. And we're also working with the pharmacy school in Dr. Kershan's department to build our community health ambassador program through which community stakeholders take leadership of teaching health equity and information on diabetes and hypertension education. So we are excited about continuing that work and talking to you more about how community members are significant to research.
Let me say popcorn. Anyone, if no one else is dying to go next. Good afternoon, everyone. My name is Dr. Samantha Francois, and I'm an assistant professor at Tulane University in the School of Social Work. In that capacity, I teach. I won't talk a whole lot about that, unless it comes up naturally. But another important aspect of that role is that I do research, and my area of research looks at the intersection of micro and macro system influences in neighborhoods and schools and how they impact the mental health and academic outcomes of African American adolescents. And I look both at risk factors but also protective factors that sort of work as intervening variables in those relationships. So I look at risk factors like exposure to various types of violence, primarily neighborhood and community violence, but also protective factors like the presence and availability and quality of social supports and connectedness to social resources within one's neighborhood and community, and also on an individual level, one's own racial identity development as another protective factor. The project that I will focus on primarily in today's conversation is a project that is a pilot project of the LA Community Scholars Program, where I'm the academic partner, and the community partner unfortunately was not able to be present today, is Cafe Reconcile, and our community partner, principal investigator there, is Kathy Lickfield. And the project, Cafe Reconcile, was funded through another grant-making entity to implement trauma-informed care training of their staff, from executive level staff all the way down to the staff who work in the restaurant. They had been noticing that the ways in which staff were working with and engaging with their students, the youth that they served, was not trauma-informed. Let's just put it that way. So they were really interested in that as a starting place to train their staff around the principles and practices of trauma-informed care. And so we came together, myself as an academic partner and Reconcile as a community partner, to look at how do we measure the effectiveness, success, impact of that training. So that's been the focus of our work. We're still very much engaged in the pilot project. I'm certainly going to talk about it, and am happy to talk about the work we've done so far. But yes, the work is ongoing through June of next year. So we do still have a ways to go. So I'll stop there.
I'm gonna tell y'all I don't like to talk. Anyway, my name is Katner Haywood. I've worked with the community for the past 30+ years. I am co-founder of an organization called Women with a Vision. I have been with Tulane for 20 years. Actually, this is my last month there. And that's good. That's fine. It's not a problem, right? So I've worked on a number of research projects with Tulane, but I'm not talking about Tulane's projects right now. We're with LSU around a few projects, and right now we're working on something that's called CEOR. Can you hear me without this? No. I'm really young. Who said no? Hello. I know you can hear me. I don't want to do the microphone. Leave me alone. They can hear me. I got a big voice. Anyway, so I work with LSU around a project that's called CEOR that we're partnering with UCLA. And that's, I'm going to give you just a little bit about that. But my main reason for sitting up here is to tell you my feelings about research and community that I think is extremely important. So, and basically, I don't have 3 minutes of conversation to sit here and tell you, so we're going to pass it on here.
I'm Adrienne Katner. I'm an assistant professor at LSU School of Public Health in environmental health and occupational health. I was one of the first cohorts of the Community Scholars Program. I worked with the Southern United Neighborhoods and a Community Voice and Lead Safe Louisiana to investigate lead levels in New Orleans drinking water. Drinking water has been, and heavy metals in particular, have been my sort of focus, my fascination. Once I started doing this research, no one was interested, and then Flint happened, and all of a sudden I'm getting a lot of media attention, and I'm getting a lot of calls from the community saying, help me with this problem over here and that problem. There's a lot of environmental issues in Louisiana. So I never wanted to get involved in the community, but it just sort of happened because the community found me and hunted me down and pulled me out. So since then, I've been involved in other projects with the I-10, with Colfax in Louisiana, with the Louisiana Environmental Action Network, and along the Mississippi River, the corridor. So, pass it on.
Well, hi, my name is Lang Wei. Well, comparing to all the individuals out here, I'm not to compare. But I'm from the community side. I am a resident. Well, I actually started out, came here as a refugee at age of 7. I lived here for the last 44 years, going to 45 next year. So in terms of health disparity, coming here as a child, living out in New Orleans, doesn't understand the language when you came here, your parents, all that. Actually, I was reflecting on this and it's like, oh wow, maybe I could be a study subject for a lot of you. Been there, done that, got all this medical problem, you know. So, but from where I'm standing at, you can see I'm from an accounting background, and then going into banking and insurance. I go out there selling insurance and investment and seeing that, oh wow, you don't even have health insurance, and at that time you can't even have health insurance, let alone how can you afford life insurance, right? So from there, that's why with the first 3 years I was able to meet my target, but then after that, I didn't make it in the business. It kicked me out literally, because what I did was my focus changed, because I ended up helping people enrolling for children's health insurance at the time. Because health insurance, it's so important that, a lot of people doesn't know that it's out there, for our children. So from there, my focus kind of changed. And then Katrina came. So with Katrina, it kind of moved my focus into helping the community in terms of recoveries and going through the aspects and understanding the dynamics of the health disparities, all these chronics, disease. And I can sit here and it's like all those chronics, I'm one of them, because I'm sitting here with chronic pains and feeling, well, this is back then. In terms of my parents, my elders, they have all these pains, but they don't understand where the pain's coming from. So you go to the doctor's office, and all you get is pain medication, and now with all these problems. And with our seniors, like you go to the doctors and you leave the doctor's office, if the doctor's not giving you a prescription or sample, then something's wrong with that doctor. And working with Baptist ministry, it has changed our thinking, our process, and be able to take what was given to us through those process, train the trainer, as a lay health workers, to take this information back to our community and educate, because it's what's that phrase? It's hard to teach a dog new tricks. That's what it is. Understand when you said diabetes or diet, the term is like diet, starving yourself, right? Fasting. That's not it. That's not how it goes. So when researchers work with communities, we need to choose the right words and choose the cultures. If you're in a community culture, you need to know where they're coming from, what have they been going through. So just plain language would help. So with our capacity, we've been pretty much the go-to, and in terms of research, and I was just sharing with one of my coworkers, is that we provide all these research, you're bringing them in, but it's like, who's giving us the result? We have no results. But I know that people are dropping dead with cancer, different cancer. I don't know who's from here, from Tulane, but you can see that when someone is being referred to Tulane, they have 6 months to die because of the cancer rate. And it's not from the environment, it's just, the illness that we've been having for years. Hepatitis is one of them. Lung cancer. People are not smoking, but they're getting lung cancer. So what is going on in our community environment? There's St. Maxon Canal. I know there was a study done for that canal. There was money that was invested in that study, but we didn't get any results. But you know what? We're telling people not, if you go out to the flea market, you know who's growing what. If they use the water from the canal, you know not to buy that greens, because you know why? Because when you boil the greens, the water is not coming out green. The water comes out dark. So we know not to buy those greens. So what I'm sharing, what I want, at least for researchers to get out is share with us the results. With any community that you come in, share the results. Because I know about 5 years ago, Dr. Sunwin, actually, he was working with Tulane to do a study on hepatitis. At that time, I think Gerard, the drug company that came out with hepatitis B drugs, that they're giving free drugs for hepatitis B. So there was a screening at one of our festivals, and I was one of those individuals who came in for the screening. I can tell you 9 out of 10 people came for that screening, all were positive for hepatitis. So after that, people were just lining into the clinic to get help, because before that, people were dying from hepatitis B in our community. And I can tell you, on an average, within American Vietnam Church, at a minimum of 15 people died a year and I would say more than half of that are from cancer related. So, so I know I'm not, but you know, that's why it's important.
Thank y'all so much. I think Ms. Lang, you went right into what I was going to first ask, and I'll ask the first question, and then folks, please jump in. I know it's a lot, even what they share, that you can ask and we can glean from. So please project, because we're going to keep that first mic up here for the panelists. So please stand and say your name and project. Hopefully that doesn't discourage anyone from asking a question. We're all a community here, so please ask. But I just wanted to ask, and you went into it, Ms. Lang, what has worked well and what hasn't worked well? I would ask someone else to share, because I believe you gave good pointers. What has worked well and what hasn't worked well in partnership building with academia on one side, or even with community definitely with community on the other side, in the research projects that you all are discussing, and even those that you may not have shared about. But what are those, takeaways where you said this was really a good partnership because of this reason, and then this one I would totally do this differently, or there's something that completely needed to be changed and improvements to be made on the other side. So if each person can give a brief response to that, that would be helpful.
I find what works well is that we are invited to sit at the table to share, because we are in the heart of the community, and we have community members coming to our office for a lot of things. And through that, we pretty much, know all their histories just by that. So in that regards, we were able to sit down with health insurance through the Medicaid providers. There are 5 of them, and we share what the challenges individuals are facing. Just because you have health insurance doesn't mean that that's done with. That's just only the beginning. A lot of them are not able to access in terms of transportation, language. It's a challenge for me to call in to schedule an appointment. What makes you think that the individual will be able to get through? So through that process, we have sat down in focus group. I know with Noella, when they first were going through the study to bring a clinic out in the East, even before New Orleans East Hospital was coming back, is to have a focus group to identify what will be able to help, in a sense of you're in the middle of the community here. How are you going to work? So in regards to, you have patients coming in, and that person needs to have a colonoscopy. Here's a referral for colonoscopy. That's not going to work. But if you're going to sit there and schedule appointments, like, hey, your appointment is on such and such day, well, I don't have transportation. How is that going to happen? Well, you know what? We're going to take you there. That's how it works. And I see that a lot of them are going through that process. And they have staff that are actually within the community, where they trust, where they're taking them to the appointments and get those done. And I think that's important, and it's critical in terms of providing that extra, because even though that you have health insurance doesn't mean that they're using it. So even for health providers, insurance company, they're going to see that is a missing piece. Just like with the individuals that are 65 and above, they have assessments that have to follow through them as part of their, I guess, contract with Medicare, Medicaid, CMS, that you have to provide all these assessments. And if you're not getting the result back from the individuals, then you're not fulfilling your requirement. So even if they're setting out saying, hey, do this, and you get $50, where are they taking it? They're taking those assessments into us as a community center, and that's not our job. Our grants, our funding are provided to us to work around other issues within the community, but because this is something that is important, we have to step aside and do that. So a challenge, what does not work for us is that companies, insurance companies, they're there making the money, right? But bringing the challenges up to them is like calling in. We can't be calling in and spend another 30 minutes on the phone where we're sitting there with your clients helping, but in turn, you have to go through another interpreter, which takes our time. So those are some of our challenges that we encounter in working, providing the service for the members, and then.
I'll be brief. I could say a lot right now, what hasn't worked. There's a lot of issues that, I'm still learning how to do this. I'm not the best at conveying, this is how you have to go and collect this sample. And so my community partners sometimes will cut corners and that messes things up. So it's a learning process. But I think one of the more important things when that question was asked, what hit me was what I used to do is have a research question that I would try to put upon a community group and recruit from there. I stopped doing that. What I do now is the community comes to me with their problem, and then I try to ask a research question around it to get a grant for them to do it. And that's been helpful. And I've also really invested time in the community group, and I give back. Really, really important to give back, whether it's educating neighborhoods, giving them some educational materials, whatever it is, talking at these neighborhood meetings. I think that's critical to establishing that trust.
Positive. I think CEOR, and I really haven't told you about CEOR yet, but CEOR has been a good study where we have academia, community, and patient advocates who work together to make this project work. So I think CEOR is, from my point of view, pretty good. The negative side of research for me is not giving back to the community that you use to get your information, to write your papers, to get your grants, whatever, and then you don't go back to give them what they want to know. That's a big problem for me. Also, in the beginning, when you do your research, when you find a grant, and I think it was just mentioned what happened before in past, that you come up with a question, and then you just get out in the community and say, this is what you need to do. This is important to you, and it may not be important to them. So you need to get out and talk with community first. You need to see what their needs are. Yes, they need to know about eating healthy. Yes, they need to know about diabetes. They need to know all that stuff. But if you don't approach community in the correct way, you're not going to get any of that. And your project's going to fail. So those are I have pet peeves around research and whatever. So that's some of my information, some of my stuff.
I'll be brief as well. And what's worked and not worked for me, and I'm the academic partner on the academic partner side, I think taps into what the previous panelists have said. So in the project that I mentioned earlier, the project in partnership with Reconcile, in that community academic partnership, I found that what's worked really well is that them as a community partner really taking on the leadership role to identify that problem, shape and inform the research questions. They really took ownership of that and really engaged in it and was the lead around shaping the research agenda. And I felt like that worked really well. What I think we need some improvement on, and that's something that we're actually engaged in as this project is going on, is that if the agenda wasn't, even though the community partner was shaping it, everybody within that community didn't have equal part in shaping that agenda. And we're seeing and feeling the effects of it, where there are individuals and members within the community who feels like it's getting some at what the challenges are and ways in which they think they need to be addressed, but not all of it. So we are actively working to engage with the partner around getting better representation across that entire community in the work that we're doing.
So what's worked well for us is to be transparent about our mission, our goals, and our purposes of the work we're doing. And this is when we're working with community stakeholders, even as the CDC, working with community stakeholders in building our partnership network. But we also appreciate that when we're working with academia or academic groups and institutions when they want to work with us on a project. But having resources works well. It makes sense. When a grant is being applied for, there's shared resources, not just in what we contribute as a community partner, but what the institution that's applying for the grant contributes back to us. Resources could be in the form of money and payment. We pay our community health ambassadors. They can pay our organizations to pay our community health ambassadors. Also knowing that there's equity in the time that we have to put in to plan, to meet with them, come to the table. It works well when our academic partners come to us. We don't always go to them. And we've been pretty clear about that. You know, you can come down to our neighborhood to see who we are and take time out to meet with us as well, instead of us always going to the other side of the city. So we share time and those types of resources that we have as well. What's really important for us that works well, another thing is front-end planning. Like what Katner just said, is start on the front end with an idea or a need, identify the problem, work together on the logic model, and assume that everybody has some wisdom and some smarts, and community members live lives, they go to jobs, but they don't go to jobs. If they go out to work, they work in their house. Whatever they do, they have wisdom, they have intelligence, and to respect that and honor that. So we want to be clear about what the power systems are that are driving the initiatives that people want to research, and make sure that it's a good fit. We walked away from potential partnerships if it wasn't a good fit. We're not desperate to have the partnerships. It has to make sense, and it has to be equitable.
So I'll yield to the audience, to the group. I think there's a lot of pieces there for us to chew on and for us to ask more questions about. And I know a lot of what you all said are things that we're going to talk about in the later sessions too, and bring up power systems, power even within the community partner, who are the gatekeepers, how is that working? So what questions do you all have? Please stand and say your name and go on.
I'm Sonia Carroll with 504 HealthNet, and I have a question for Dr. School of Social Work at FAA the training you spoke of, what does that involve with your the staff that kept it? What does that look like when it comes to being trauma informed?
Thank you for that question. So the training is an adaptation of trainings that were designed based on the SAMHSA, what is that? The Substance Abuse and Mental Health Association. So they have best practices around trauma-informed care curriculum that have been implemented in school settings and community-based settings. And our training implementer, she actually took a curriculum and worked with Reconcile to adapt it to their, specific aspects of their community as staff and the youth and the students that they serve in terms of topically, in terms of delivery of the curriculum. So it's a curriculum that has 8 separate sessions and they're topically focused. There was adaptations around the delivery of each session. So a lot of the way the curriculum was designed was really sort of lecture-based and didactic in nature, where you have a trainer presenting the content and the people just sitting and receiving it. We learned from the partner that was not going to work for their population. That was not going to work. So the trainer who conducted the trainings, and she had a partner as well that co-led the trainings with her. That Reconcile vetted as well. And they work with Reconcile to really adapt, as I said before, the content of the sessions and how the sessions went forward. And adaptations were happening as they were being delivered as well. Because we're working as a pilot, we have the luxury of adapting as we go. because the project was for us to learn also about the adaptations, what worked, what's not working for this particular community. I hope that answers your question. You're welcome.
I think Dr. House, you have a question?
My question was, I know we talk about, and this could be answered by any of them, the panelists, is that, you know, we talk about we do research, we include the community on the research, but we need to later translate that back to the community. What do we do with, how do we do that? And what works in your experience for how do you get the information back to the community? Because we often do a report, we say we're done, and that's it. And so any recommendations about how we can better get the word back to the community?
So I will say this, one of the things Tulane did for their last research project was to have an event where they did a toolkit, brought community back together to share that with them. That was part of what they did, right? But I also think, as far as your question, even if you have to have a town hall meeting, you're finished, you've done your paper, you've done this, to go back in that community and say, this is what we got from you. This is the results of what happened. And this is how we may still be able to help you to move forward. I think those things are important to community. And if you do those things, then you can go back and say, okay, I found something else. Maybe we could work on it together. And if that trust is there, then you're going to have that. But if you go back with nothing, if you never go back from the first time, they're not going to want to work with you at all. So,
media is one good way to get the word out of your results, if you can get it. Also, creating educational materials and giving them to the groups that you work with, talking to the groups, going to their meetings. This is one give back that we created for the ITEM project. We're just trying to create a book of children's experiences and their environmental monitoring, so that we can sell and get more money to help the community in their efforts to whatever they're wanting to do, change policies. Changing policies or bringing your results before city council or whoever you need to bring it before and say, this is what I found. Hopefully that will change policies or not. But I think moving on beyond just writing a paper is extremely important because it's got to mean something.
Absolutely. I just want to say that what we've done in the past, for instance, write a lay summary of the work that we've done in the community and actually go back to that site. And I've taken it to that, for example, community center, and handed that to them and been on hand to answer any questions or whatever. This is after the fact that everything's done, the paper's published. And one thing that we're doing with LaCAS, with the health promotion and dissemination piece of it, is that we are doing lay summaries and posting that on our community website. We're trying to make it user-friendly, if you will, you know, speaking the community language, so it's not all scientific, if you will. So we're doing a lot of that now, and it really does make a difference when you go back and let the community know how much you appreciate them for allowing you to come into their community. And it starts from the inception. You know, don't write the grant without including them. You need to do that first ground level. Their buy-in is so crucial to what you do up the road, okay? And if you let that community guide you in how you want to proceed with every factor, Dr. Sarkon presented all of that in his initial presentation. If you do those steps, it works. And we did this project in Franklin Parish, and whenever I'm there, and Franklin Parish is 3 hours one way from backward. So whenever I left to go to that community, I had to have everything I needed. And if I forgot something, it was over. I just had to go buy whatever I needed in that community. But when you're there and you give back, they remember you 5 years later, oh, look at that lady. They came up with the study, people united to sustain push. They remember that. And I said, you still remember me? Yeah, you was all at Walmart, you was everywhere. And of course, we did everything in the churches, because that was key, you know. And when you're really working with the African American population, church is one place that we most often congregate on Sunday mornings, but it worked well on implementing our research in the community. And then giving back and having those community people buy into the paper as we wrote it. It made a big difference because it's, oh, here's my name. You know, they're all acknowledged in that piece. And you share that with them. It really does make a difference. And if they buy into it initially, then they feel what? They own it. It's what I've done it. And they're excited about it. Because you want them to be as excited as you want. Just a few things to say.
Thank you, Dr. Xavier, I'm going to let Dr. Francois, I know you have something to say. And
Just a quick add to that, because I think it's just in addition to what you just shared. One thing we did in our data collection processes in this project is ask them, how do you want this information to come back to you? What would be useful, meaningful to you? And what we learned was that, you know, they wanted a presentation of the findings. And so in working with the community partner, what we decided is we're going to present the findings to them, have a discussion about what the findings mean in the context of them developing their own next steps and action plans for their community, for that organization around those findings. And that's what they decided, how they wanted the information to come back to them. So I'm using that as an example, and that was in creating that question in our data collection. I don't think this is on. In creating that question in that data collection, I was intentionally trying to get ideas from the community of how do I give this back? Because I recognize the importance of that. Because I wanted it to go back to them in a way that was most meaningful and useful to them.
other questions, Dr. Burks?
I just want to add to your comment as well as to Tori and to Dr. Kennedy. The other thing that you can get the community involved from the academic position is to bring a community member with you when you present your papers at a conference. I worked with Reach 2010 at the Heart of New Orleans, which was a research project here before and after Katrina. And the principal investigator presented at one of the conferences, and she brought one of her ambassadors, who was a part of the research project, to the presentation where she contributed on the podium about what part she played as a community advocate and also a participant in the study. And that's one way to engage the community and helping them to understand the findings of your research study, as well as to present it and disseminate to all of the community that they are a part of, as well as to the larger audience.
I think
And
that is
I add a little on that because we have a project about cancer in African Americans, and we began first generally learning about cancer screening, prevention, and the decision when we wrote the proposal, originally we thought we're going to go back and have a community cancer forum when we present results. In that forum, the community said we want more, so we wrote another grant and developed materials. And after that, presenting those materials, they told us we want more, and now they wanted to focus in prostate cancer. So now we have a project in prostate cancer. So it's the way when you are giving back, the relationship extends. And we were not only presenting together, but we wrote a paper with community as authors in the paper. So that is when we begin to work together. So sometimes we believe that that the community cannot write a paper? Yes, they do. And they can edit and make changes and lot of growing up and learning together in just writing a paper together. It was a great experience. I really challenge all of you to do that because it's possible.
Other questions? That brings up something for me, Dr. Xavier, and I wanted to learn more about just what you said, but the interplay between effective community engagement and community partnership and scientific rigor. And it's just as what you all have been discussing, but how do you work to build the capacity if the capacity isn't there for folks to be the PI, the principal investigator or the co-PI on that project, or to present, or to create the paper and do the lay summary. So what is the interplay between effective community engagement and scientific rigor? And I'll start with Ms. Ferdinand. I think what you mentioned earlier about just community being significant in research speaks to that.
Okay, I'll tell you that I was a little shy initially working with academic partners when they would say, you can be the PI or we're co-PIs. So it takes education and teaching. You have to be open and humble as an academic partner and be willing to work from that type of framework. And just look at community as I said, as an equal partner with you. So it empowered us to feel like we were really a part of this plan and a part of the decision making, and it helped us to also transfer that level of work we're doing with the academic partner with our community stakeholders who are also working with us. And that's how we approach our work. That's the culture of our organization, and so that's the culture that we bring to academic partners, any type of partner we work with, that we're sharing this work. So even the recent project we were working on with Dr. Sarpong and Persian Nation, we were trying to decide, well, who will be the PI? And Dr. Sarpong said, well, you're the PI. You're doing this work, and we'll share it, and we can be co-investigators and contributors and so forth. And so it's just understanding, if I'm answering your question correctly, that it doesn't take away from the level of scholarship that academians bring to the table. It actually enhances your work and it makes it more relevant. We use both qualitative and quantitative research. We do surveys, we do photo voice. There's so many different ways to get feedback and evaluate your programs. And it's important that you really understand the value of being open and transparent when you're working with community. It'll make the project so much stronger. And it's what funders are looking for anyway. That's what they want. There's no way to prepare a grant or a proposal that's going to be competitive. Most of them in this day and age, it seems, that without having community members at the table. And I'll just say that I know we work with a number of different groups. And research is not just a scientific research in this setting. It's not just it's not our only approach to work. But when we bring groups to the table, there's a group that we're working with and partnering with on housing. Our stakeholders vet them. It's not me. I'm not the owner. I'm a liaison and a representative. So we sit at a table and we vet, and they make a decision if we're going to move forward or not. And one of the decisions, one of the factors in making that decision is how are they being respected? How are they being talked with, not at? How is their voice being heard? And that's important. People want to see their name somewhere. They want to be acknowledged. So that's been our approach to recognize the importance of being a principal investigator in these projects.
Did you want to share, Ms. Haywood?
One of my things, and I don't know if I'm answering this right, is working with LSU. One of the things we want to do, and I'm not sure if that's a conflict with this or if we end up partnering with Xavier, but is to teach community. And I'm not talking about bureaus. I am talking about people who live in Greytown, or people who live in the ninth ward, to learn how to do their own, to find a research question. How do you come up with that? Granted, you have to, we tell people all the time, you will end up partnering with academia. But you're the lead, which is what Rashida just finished talking about. You're the one in the lead, right? I think that's important for community people to learn, that not always academia is going to come and bring you the question. This is what they want to do. Sometimes you can go out and find your own. And so, yeah, we're working on getting that type of information out to people. We're planning on at some time to have a whole series of training for community, and that's why I've said we may end up partnering with Xavier to do this. We don't know yet. We haven't been a conversation that we truly had at the moment, but I think people need to learn these things and continue to partner with academia. But let's say the 51% of that grant money will not go to whoever. It's going to go to you to do within the community. That means you hire community people. Yes, academia will get part of that, but not as much. And then people will feel, well, I'm worth something. Yes, we got a grant, but I'm being paid to do this, this, and this, right? Not freely. Do a survey, do this, whatever the deal is. So that's, yeah.
So speaking to that, one of the things that we did, because one of the things that will help scientific rigor is if the partners we're working with understand the lingo. And so we've actually developed a citizen science lesson plan for high school students and for grade school students to engage them in neighborhood and community work. Asking the question, coming back to the class and saying, this is what my community is concerned about, coming up with the study design, then going through the study and then creating the outreach or intervention or policy products that will then bring that community to the next level. So it is about educating the community as well. And they improved my scientific rigor. I remember when I was working and I was making my instructions for the sampling, it was very, very scientific and everything. And my community group said, nobody's going to read that, Adrienne. Just do pictures. And she was right. I did pictures, and everyone did it right. And so they improved my study. And so it's a give and take.
Some other questions from the audience. As I said, you all are going to drive this discussion, so.
I have a question. So when we are talking here about the community and the academic, we are separating ourselves. So I am the community, I am the academic. And I always say we all are part of the community. Yeah, because we belong to the community. So sometimes we can confuse our roles and play two hats as the academic or researcher and as the community members. How do you separate that when you are working with your participants?
I have a problem because with that, doing that, because a scientist is supposed to be a scientist. And you're supposed to be removed from your community. You're supposed to be unbiased. You're working with a community and they want something. Everyone has an ulterior motive. They want to see that improved, or they want to see these results so that they can take them to the city council or whatever. So I'm still working on that. I don't know how I think it's important to keep your own sense of, you have to approach this as a scientist, and that you may get emotionally drawn in as a community member. But you really have to say at some point, these are my results. They may not jive with the agenda of the community group, but I think if you cross that line into emotion and community and forego the science aspect of it, you could lose trust amongst your other peers, your scientific peers. And once you've lost the trust of your scientific peers, you know, you've lost it.
I think, so I represent, regardless to where I work. No, I don't. I represent community, right? I am there, when they can't be, I go to their meetings, I listen to what their needs are. I come back to the table with their needs. So basically, I represent community, right? I work with community advisory boards, I work with just community as a whole. I'm not an academic. Yes, I work with Tulane, but that's not my role, right? Because let's be honest, there are things I don't know. As far as being I don't, right? So I'm there to represent community, and I don't know that we may be a week, but I'm not clear that we are, right? And it's not a them or us deal, but still, it's not, I'm not that piece like that. And don't get me wrong, I understand some of the research. I just would like to see a little bit different the way it's presented to community and the way it's done. So yes.
Dr. Francois, what has been your experience with that?
Yeah, I was just about to jump there. Thank you. I too, like Adrienne, struggle and am still learning of how to have that balance, right? And one way in which I attempt to do it, I want both worlds, right? I want to wear both hats. So a lot of my research, I use a lot of mixed methods designs in my research. And by doing that, so using both qualitative and quantitative, I feel like I can get away with getting both, where, you know, when using qualitative research methods, it's okay for the researcher, the scientist, to be in the questions and to be in how the questions are being asked and to be in how the data is coming out. That's okay and acceptable in, you know, several qualitative approaches. Whereas if you're doing more of a quantitative approach, it's not. So I think that's one way in which I've been attempting to do both. But, you know, am I doing it right? I don't know. I honestly don't know. I'm still learning because it is hard.
In your response, I think it's a great idea for academia to be a community maker, because then they can be with the community, they can relate to them, especially if they're passionate. So you would be actually more successful in getting the community member to come on board. So I don't see anything wrong with that personally.
I want to go in this. What I found out when they did the joint research with Research Triangle International and with the Food and Drug Administration, that I feel is a major part in research as well, is that the verbiage that's being used for the research when we go out to communities, a lot of times the verbiage that's being used, the actual participant do not understand. And I found that, so they might answer and we're told to read verbatim and not just put out answers and little questions and read just what the response is, but then that gives a lot of error in really the actual research that they need, the answers that they really need, because the information and the verbs that they're using cannot reach that audience. They don't understand. So I think that having someone to be able, when we have the community meetings, being able to just use the language of that community and then not, you know, using the word that they don't understand. So they're just saying, giving an answer just to be given an answer, and then when it comes back to the statistical information, it's not really correct.
It's just like you say diabetes, but in the community, we want to say sugar. They understand sugar. They don't understand diabetes and everything. I'm sorry, we jump in there.
Dr. Shepard, and then Dr. Sampson, and then Ms. Collins.
I was going to say my lens is probably a little bit different because what I found is, at least in science, biomedical research, et cetera, we're taught that to, try to embrace this objectivity, but the objectivity is an illusion. We are inherently subjective. You bring all of who you are, you bring your culture with you, and everything that you do, and that design and that engagement, et cetera. So for me, I'm inherently a researcher and academic, and I'm part of the New Orleans community. And so I think that a part of what happens, or at least for me when I'm understanding community-based participatory research, is we're essentially asking people to have a cognitive shift, right? And intentionality. When you're creating these grants, when you're going out into the community, when you're doing different things, understanding that, you wear the academic hat, right? And you're writing in grants, et cetera, and you're an expert in that, but you're not an expert in this community. And so then you need to go to the experts of that community and have a mutual exchange. And that's where that democratization of knowledge comes, and that transparency and those the ethics of that. And so I think for me, I don't necessarily have that struggle because my work is more often than not tailored towards intentionality of I'm going here, trying to find out what's happening and what can we do to help this issue, or correct this issue, or educate on this issue, etc. And so I think that and part and that cognitive shift has to start to be a part of those conversations, these conversations, and what's the point if you're going to learn about sugar or diabetes? You just want to write your report. There's no intentionality beyond that, other than building your CV and getting rank. And so I feel like that always walking in with the understanding that your subjective reality will automatically inform what you've been trained to believe is objective. And that you are, again, the expert in this bubble, but you're not the expert in this. I'll tell y'all an example later. But anyway.
Yes, I guess for me, it's kind of, was listening to everyone in the sense of the theory of how I see what everyone has said. I look at it in the sense of all facets of who you are is going to inform everything that you do. We're so busy trying to distinguish how we're different. Most people forget and miss how much we are actually alike.
Amen.
With your research with metals in the water, it's hard to separate me being a scientist if I'm living, taking a bath, drinking water every day. So how can you separate the two, right? That's going to be very difficult to do. But at the same time, we all play 50 roles in our lives. You're a mother, so you know when to turn it off and on. You're a wife, you're a husband, you're a son, you're a janitor on your job, you're a scientist. And so you have to really kind of figure out in the most unbiased way possible, right? But in the most informed way that is inclusive on how to come up with something through understanding and how to kind of achieve a goal that is universal and that can assist all sides of the plate. I think if you shoot for understanding, like we said before, it is difficult when, coming up with verbiage and coming up with these different things, but they don't understand. It's like, I have to say, when you have touch of the sugar, when your fingers tingling, like you're doing this and you're doing that, we may come up with different terms. But as you're developing it, I have to understand, or get other people to understand, how is this being described, how do they interpret it, how do they see it, and how do I see it, and how do we bring these two worlds together to figure out whatever it is that we're trying to do. So it's no longer about me being an academic, you being a community. There's no difference. There is no difference between the two. It's not, to me, how I see it, we're all shooting for the same goal.
I see the same dichotomy happening for scientists with policy. So we were always told, don't get engaged in policy, you just show the data, and then you step back and let the policymakers make that decision. But we're in a world right now where the policymakers are not listening to the scientists. So we have to step up. And it's hard, that's like you're crossing a boundary. But some groups have laid down some ground rules, and I think that helps. Those ground rules. Don't be an expert in something you're not an expert on. You know? Don't pretend, you know, make people understand what you don't know, the uncertainties, things like that. So if you have some ground rules to help you navigate that tightrope walk, that balance, that I think that can help both policy, in both that community and academia interaction.
So,
That's how. I think there's the training that you have that tells you this is how it is, and then I think there's the reality of how it really how we are. And I think if people see the people who are the subjects of the research in themselves as one, as their human being, you relate to them. This person could be your mother, your sister, your brother, you know, your son, your friend, your cousin. You know, relate to them as a part of your, because we all are still in a community. And the reason why people decide to take on an issue is either they care about it personally, they care about it for their prestige, monetarily, whatever. There's some reason there. And I think research has got to get a little deep too on their identity and their purposes and why they do the work that they do. Because whether you believe that you're personally involved, you are, even if you don't know a person or you don't think you care about something, and there's a reason why you're doing it. And it might not be genuine. It might be, it might not be. But that's what's important, is to just really take a look at yourself too. And I think that's because people are people. The policymakers who aren't listening to scientists are not, because they care about something else. And they're still being biased. And the scientists are still going to be biased. That's why we have experiments on people that are inhumane. And when we don't respect people in community as we work, it's the same type of inhumane action. So I just think it's important to see yourself in the people that you're working with.
Ms. Katner, if we follow the guiding principle when you ever work at the conducting research, is always tell the truth.
Yeah.
Be ethical in every way possible. Whatever you do, when you involve yourself in this kind of work, especially when you're working with the community. Exactly. I don't see how you can be biased in any way at all whatsoever if you tell them the truth. Nothing should prevent you from doing something.
and I like it that because we have next the presentation about ethics in CBPR. So that matches perfect.
Lisa. So my question is, what experience have any of the panelists had in vetting the tools that you're going to use out in community with the community themselves? So vetting the surveys, the evaluation tools, you know, or whatever, particularly if they are in another language. And in New Orleans, y'all know that means that, you know, for District A, the language is different than, you know, District E. You know, and I'm mentioning this because I did a project with Lang, and I had a short window of time, but I literally tried to translate, and I did translate the majority of it online. I did a blood pressure weight loss program with the Vietnamese community, but I knew that I presented it to her, and I said, you know, before we do this, I need you all to look at all these documents to make sure that this is, and some of them she would, I can't remember exactly, but she was like, well, it was something to the effect of, we're West Vietnamese, and what you got on Google was Southern Vietnamese. So it's like totally they won't understand it at all. But we were able to actually get through it, but I let them vet it, and then I did not interfere in that project. Once I handed it over to them, I basically said, please adapt this literature into the way that you need to do it. But we actually paid the community to translate a lot of the evaluation tools and the surveys that we did with them. But I'm just wondering if any of you have that experience of, you know, doing the materials ahead of time and giving it to community instead of on the back end and learning, oh, people don't even understand this.
If I may, your example is excellent. I feel like we don't even need to give examples. But I will share one. It's a project that I did some years ago in partnership with Arts Council New Orleans. And they were implementing some summer youth programs. And they wanted to evaluate the programs. And so I had this survey that measured a range of kind of psychosocial outcomes. And, you know, they were measurement tools that, you know, I found all these wonderful measurement tools that have, you know, strong validity and reliability and all the great psychometrics, and they were age appropriate, all that fun stuff. And they had a youth advisory council. They no longer have a youth advisory council, but they had a youth advisory council at that time. And we said, let's show these questionnaires, tools to the youth advisory council and give it to them and see how they would reword these questions so that they and it was it was kind of like we took the survey tools and workshopped them with the youth advisory council. So we sat down with them, and it wasn't a whole bunch of us. And we literally went question by question, and they were like, why don't you just ask the question this way? Like, you know, if I was filling out this survey, if you just asked it this way, it would be a lot easier for me to answer, or I would understand it more readily. And we did that, and we rewrote questions. And those are the surveys we actually administered to the young people who were engaged in the summer program. Now, on what happened on the back end for me is because, again, you know, I'm working under this quantitative research paradigm, is I did some psychometrics on that completely reworked measures, and they were still strong. They had good reliability, they had good validity, and so we did it on the front end rather than on the back end, and it worked. It worked. So
yeah, and for us, you know, I was basically used to working in a totally, you know, African American churches. And here I was working with a Vietnamese community, and we did a blood pressure weight loss program. And so even a lot of the recipes needed to be changed because they use a lot of rice. You know, they don't do fried chicken and red beans and things like that. So, you know, I gave them the creative freedom to tell me we're going to be making, you know, these kinds of changes, and there's certain language. I even was kind of intentional about changing the photographs that were in the original document to make it look like the community that we were serving. You know, so, you know, you have to do that, and sometimes people are not intentional about those things.
I think most academics, right, may have surveys, but they do have them for those people who may be part of that community, or they work with that community, and then you go in and you change some of the language so it fits. They don't just throw it out there and say, take this is the survey, you don't need to look at it, this is what it is. They really sit down with people and go over it to make sure that it's correct, the language is correct, so to fit the population. Now I wouldn't be able to translate not one thing from English to whatever, can't do that, right? But still, the language is correct for the population. CEOR, we did it for CEOR. We've done it for programs, for other research programs within Tulane. This syntax, you know, this wording is not correct. This is going to insult somebody, right? So those things do happen.
Yeah, I mean, I've seen instances, particularly here, where, you know, folks are working with say a Latinx community, but the presenter is expected, they're given the English manual, and the presenter or the researchers are expected to, you know, deliver that using the English, you know.
Ms. Lang, before I get to Dr. Xavier, I would love to hear how you experienced this on your end I know Ms. Collins talked about what BCM was able to do and how you all were able to vet the materials that they use for the diabetes program, blood pressure, weight loss management. But how was that experience for you all at the end? Yeah, I just would love to hear how you took that.
Yes, and that was a successful program in a sense that the materials, or even with any language, common language, so that way the community can understand. Even if you work with an American community, you have to know which community that you're going into. And the same with any other community, such as Vietnamese. When you talk about different health problems, diabetes, we hear the word diabetes, but then in term language, they don't understand what it is. You know, it's like, don't eat rice. Rice doesn't have sugar, you know, so as simple as that. So, so it's important in terms of getting the materials at the level that the community can understand. For us, it's important because, for one, a lot of the language, even with the Vietnamese language, is all new because all these illnesses are new to us. You don't experience that before, but now it's a lot. So you got to educate the community too, you know. So just like with people going to the doctor would have to speak at a language that at a level that they would understand to be able to understand how critical their health is. So it's important.
What we have done is two things. First, yes, it's okay that the community calls diabetes sugar, but we need to educate the community that is diabetes and explain them the word. They can do it. They can learn, okay? Because later they go to the doctor and the doctor is going to tell them about diabetes. So we need to educate the community in these terms, and this is possible. When we adapted the pilot test, our surveys with the community, I did it in the way intentionally. I chose people from different gender, age, and educational level. And you see the difference when the person that is pilot testing the survey is 70 years old and tells me, Margarita, I cannot read it either with my glasses. You need bigger fonts. The other people do not tell you that because they don't have those problems. So when you are pilot testing your material in the community, look at all different levels. Could be too simple for a person that has a PhD, but the PhD can understand simple, and the other person also. So that is a very important point that we have to address when we work with the community.
We have one final question.
I have a comment, the final comment. So I intentionally asked the question about the two roles we play, because when you register to this symposium, I look very well about who you are in the registration. So sometimes you identify as an academic, but you work as a community. I have seen people like Dr. Kennedy, she is in the academia, but her expertise is community outreach. Yes, so we are playing the two roles. And what we want with community-based participatory research is to put more together these two roles. So we have the researchers and scientific here, and we have the community here, and they don't speak the same language. So we are doing this training because we want the scientists and researchers learn about the community issues, and we want also the community to learn about research issues. So the problem we have now with, for example, scientists working in policymakers is now the scientists are becoming the policymakers. That is what is happening. We have now the public health professionals, but we have now the doctors want to have a title, a diploma in public health. And pharmacists want to have a public health diploma also. So we are missing the roles. And it's like, I like that. So it's not that we're going to forget that we have a PhD or we are the experts in the community, but we are building another level of communication. So later, we're not going to see the community and the scientists and the researchers. No, we want to see we together. And this is the objective of us here today. We're going to see us as we, not as these and these other ones. Thank you.
Dr. Sharpon?
Yeah, I think the comment I wanted to make was that I think we can extend what we've discussed in terms of academic and community to a much broader space. And I think it's all about collaborative science. So we should get to the point where with our work, we bring in community and we bring in academic, we need to bring the policy folks all together, because there should be a policy brief that comes out of the research. But you see, what we do in science, which we traditionally have been doing in science, is we take the ball to wherever we think our natural stopping point is. Whether somebody picks up the ball from that point or not, we don't worry about that. So our collaborations are very truncated. And we got to get into the point where we have to be very deliberate if our goal is to solve the problem for society. So that work, you are already collaborating with policymakers who can write the policy brief. So when your research ends, they pick it from there and then they translate it. You know, it's easy to say don't go to McDonald's. But if a person has 2 or 3 jobs, they're not going to go home in between jobs to go and cook. You know, I love some McDonald's fries. I sometimes just drive to McDonald's just to buy fries. And I know those folks will be upset with me because it's just $1 something. But I like the McDonald's fries. But if we know trans fat is bad for you, and that's what they're using the French fries, there could be a policy, a national policy. That's the systems level approach. That we ban using trans fat to cook. Because you can't say just don't go to McDonald's. So some people it's not practical. So we got to get to the point where the individual is not the sole burden of making sure that their welfare and their life is. There's some things we can change in this nation based on single policies, but we're so compartmentalized in our work that nobody picks up from where somebody left off intentionally to take it to the next level.
Dr. Sampson?
I just wanted to tell you all there were 2 quotes that my professors, a couple of professors used to really hone in on us in grad school. It's kind of weird because we were hardcore biological sciences. The first quote was, "No one cares about your research until you apply it to them." And so we were hardcore bench scientists. That's what we were. Nobody really cares about, what I'm mixing up in the lab. They just want to know, is it going to work? Is it going to kill me? Is it going to cure? Is it going to treat? What is it going to do? Right? That's what they want to know. But I have to be able to effectively convey to somebody what I'm doing, how it's going to go, why it's important and I need your money, or why it's important and I need you to participate. Because otherwise, nobody cared about cancer. Nobody cared about AIDS until their grandmother or their son or their sister or the neighbor got it. It wasn't until it applied to their person. The second thing that they told us, and it just really resonates, I always keep at the forefront of my mind is, with research, we have all of the answers, but you must ask the appropriate questions. The data is the data. It is what it is. We see it every day. But I have to figure out what is the data telling me and what question is it actually answering. So that allows me to think in that manner, how to shape my question. How is this happening? What is actually going on? And it challenges your way of thinking. Because what you may think and you see, right, on the top level may really be something very different. Or you're so high up thinking like this, and you miss something so simple, as Dr. Sapone talked about before, for people who are coming in the wheelchairs, you don't have eyes. but we saw it here, right? You're not even thinking about something so basic and so common, right? That it fueled your entire thought process until someone actually informed you of what it was. So I think those two things, if we keep those two adages in mind and be open, I think it will really help us advance as we grow in research in your lives, whatever it's involved.
And I just, thank you. And I just wanted to ask lastly, what is just your key lesson learned in doing this work from your perspective? And just what has true community partnership? So true, and what that means to you. What has true community partnership meant for the success and sustainability of your projects, but not just that, but moving the needle forward in terms of advancing health equity?
I don't think I was doing meaningful research before CBPR. I think CBPR made my research meaningful.
And it's the only kind of research I ever wanted to do. So I didn't have the beauty of that knowledge, but that had always been the way I thought about it approach research. Because I was like, if I'm not doing it to affect someone's life or impact someone's life in the way that they have defined they needed to be impacted or influenced, then why am I doing this? So, and CBPR was a tool to get me. It was a method or an approach to get me. I've never wanted to just do basic research.
From the perspective of a community member, it's important to have different viewpoints and data. I'm sorry. From perspective of community, it's important to have input from different communities to have a true outcome, right? So I think for us, it's important that we're being included in the part of like those as researchers or someone's doing a project.
My final word is that I really feel that, can you hear me?
Yes.
Yeah. There should be trust between the two groups so that they can be as one, which is going to take a while to get there because community is always going to feel a certain kind of way, right? I think that trust piece is so important in the work that we all do. And here's my little story. When I first started working with community, but when I first started working in HIV and AIDS, I worked in housing developments. And before I even went to start talking about it, trying to educate people around HIV, my thing was to go within the housing developments, sit there, have a conversation, just a regular old conversation. It didn't have to be about anything, but we got to know each other. That way I got to have a gatekeeper who said, oh yeah, I know this woman, she's gonna do this, this, and this. So I built trust. They trust me, I trust them. And I need to tell y'all, we worked in all three of the large housing developments. We were not scared to go in. We didn't have a problem. We were there to educate. And somebody else said, if we got somebody to go in to be tested to get whatever help they needed, then we did something. So that trust piece is a big thing that we all need to make sure that we're trying to accomplish with each other.
One of the things that we learned is the importance of data and community members being able to be aware of the information that's impacting their lives. And also it helps to see how this is comparable to other models and data that's being collected outside of our neighborhood. So we see that while we have these issues that are affecting us in our ecosystem, in our local space, it's the same work that's being done nationally, could be internationally. If you're looking at social determinants of health, that's global, right? And so that's one of our outcomes being a community-based organization. It takes us out of our space of where we are locally and connecting to academic partners that are doing work that is largely impactful and connecting with their other partners as well to learn about these as large scale issues that everybody needs to address.
Thank you. Thank you so much.